I'm showing about 36 people online.
And I'm about to admit Michelle Carter and Cynthia Hancock. So we've got quite a few people here today. This is wonderful.
Great. Well, I guess we'll go ahead and kick off by starting with Emeline Alexander from the Library of Virginia, and she's going to give us some updates on some recent changes, I believe, to the RM3 forms. And so, Emeline, I'm going to pass it over to you.
Okay, hello everyone. Kindle is hopefully going to be sharing the screen of the forms. Unfortunately, I can't do it due to my technological issues today, but oh, it's starting to share the screen.
I'm working on it. All right. All right. Which one did you want, Emeline? I don't know if you can.
If you could pull up the ERM3 form, that would be great. So, as I'm sure some of y'all have heard, the big change to records management is that we are now going to have the process of reporting records destruction electronically rather than on paper. Earlier in the year, we started doing email-based destruction due to COVID and everybody started teleworking, but the difference is that this is entirely web-based form. It's going to be great because it allows for less user errors when reporting, more consistency across divisions when they're reporting, and it's an easier way for agencies and divisions to handle records destruction. It pulls from our InfoLinks database, so if you're a locality, you won't get into any of the state schedules, state agencies won't get into local schedules. The series and the numbers are all listed, so you don't have to memorize any of the 6 digits. You can't accidentally list a record series that's premature. So if it's going to take 5 years, you can't list it if it's only been 3 years, which is an issue we've had in the past. And the record volume is there so it doesn't get left out on forms. So back when it was paper, these were all issues that we would have to constantly send things back and forth in the snail mail. But this way, it's all online and it saves a lot of time. Completed forms will be sent through review and approval over email to the approving official, the records officer, and the destruction witness. Everything has to go through the records officer in the end, so there's no way that forms can be, what is the word? Illicitly done, I guess you could say. And we've also implemented a system of email reminders that will go out after 2 weeks and then after 45 days. So if the email reminder to fill out the form gets lost in your inbox, there will be another email later on. So versus the paper where things can get lost on people's desks or lost in the mail, this way everything's in your inbox. And Kindle, if you could go to the in progress dashboard. We now have an in-progress RM3 dashboard so people can keep track of where the RM3 is from a form creator to approving official to records officer to waiting destruction. Members of the public and people in the agency can search through this in-progress dashboard and see who's signing off on what day everything was signed off of, and where the form is in case there's anything that's stalled. And then we've also created a search engine for completed forms. And if you could go to that. This allows people in the agency and members of the public to search through all of the completed RM3s, which is great because you have easy access to proof of destruction. Y'all no longer have to keep records of the RM3 forms. We keep it all in a database. And if there are any investigations, audits, or FOIA requests of records that might have been destroyed, you can search through here and pull them up. Also allows you to print and save them if you want, but it's all going to be kept here at the Library of Virginia database. And we are hoping, IT department willing, to have videos for training up on this form within the next week, as well as the website where we will have all of these links and any guidance and materials to help people learn about this and work through it. And it won't go live until November 16th. So at this point, if you and your staff want to just play around with it, see how the system works, you are welcome to do that. And once November 16th rolls around, everything that would have been submitted will be deleted and it will be the official way to report destruction. And that's about it.
I actually have one question for folks. We've got 43 folks on the call, and it's a variety of folks of our staff, our directors. I would be curious how many of you are familiar possibly with the Library of Virginia records retention. I know we've done a number of trying to do trainings over the years, but one of the questions I really want to ask, let's see if I can do it for those on the screen. Don't think it's popping up for folks. Might have a question in front of them. In order to be compliant with the Public Records Act and complete the RM3 forms affiliated with records management, each district must have a designated records officer. And I know Ms. Alexander talked a lot about that for us a bit in terms of how to also handle the form process that's changing, but I'd be curious if your district does have a designated records officer. My hope is that all of you are going to be replying yes, and that's not a hurdle we have to overcome. So none of this is entirely new. You're at least aware of who your records officer is and understanding maybe how you can transition to this for records management.
Kendall, this is Sheila.
Mm-hmm.
It is a part of our grant deliverables that they have to have a records retention officer designated. So if they're not, they're going to get pinged on their assessment. But yeah, it's part of our DCR grant deliverables.
You're right. It certainly is. I think I'm a little curious of folks' responses if directors, especially some of our new directors that are on the line, knew whether or not they had a records management officer. So I'm going to end our polling. I'll share our results. I mean, I'm really proud and impressed with the fact that 31 of you said yes and knew, and 1 of you was unsure. So really, it's a new topic to maybe a new director on the line, but one to really reconnect with your staff. I also, while we still have Miss Alexander on the call, see that Deanna has put a question in the chat box. The question, Miss Alexander, is there a method of attaching a certificate of destruction to the ERM3?
No, you don't have to attach any certificates. If you use a vendor to destroy your records, you don't have to include that. You can, I believe, if you want to send that to your records officer, it is part of the process if you want to, but it is not required as part of this.
Deanna, does that help answer your question, or others? Sorry.
Yes, kind of. So I'm a little confused. We are all, most everybody on this call is probably the records officer, and we're the ones that are going to be preparing this form. So if we take our documents or whatever we need to destroy to a local vendor that destroys them, we just keep that certificate of destruction in our records and just write the vendor's name in. And I'm not familiar with this form yet, I apologize, but I'm assuming there's a place to include that information.
When the records are destroyed, after, we're going to have videos about this. I'm trying to work my way through the video that we've created. Once the records officer has gone through the form, at the bottom there will be a section where you can click who to send it to affirm destruction as the final point. What we assume will be the most likely scenario is that records officers who get certificates from vendors will be that final point of destruction. So once the vendor sends you confirmation that the records have been destroyed, then you will click, yes, it's been destroyed. If that makes sense.
Thank you.
And these have all been very recently released. We're trying to get everything together before we send it out to everyone. So all of these links and all of the training materials will hopefully be available at the end of the week so people can go through it, work through it, see how the system is.
Helpful.
No, Emeline, I'm sorry, this is Wendy with John Marshall, and I just sent you the form because we just did a big clean out, and I emailed you the forms.
Mm-hmm.
Like you sent it back and asked me to do that. I don't know if you, so I don't have to redo that though. Once that comes online, I'm not going to have to re-enter all that information, correct? I mean, it's okay that I sent in the forms?
Yes. That's what, none of
Okay, thanks.
the RM3 stuff will be official until November 16th. Before then, you can continue to email and send in paper forms, and any of the RM25s to designate a records officer, those still have to be sent in over the paper mail.
We have a couple questions in the chat box I want to go back to for you. First, Sharon Connors asked, we're on the county's IT system. We utilize the server computers from our county. Unfortunately, they do not always have or follow the same records retention schedules policy that we have. How do we deal with that? And Sharon, if you wanted to elaborate any further.
Yeah, we've had these discussions with our county, but unfortunately, they're too large to just deal with just our department. So as of now, they have certain, like with emails, they retain emails for 5 years, which in some cases longer than some emails need to be retained, but in other cases, they may not be long enough if you're dealing with, say, a chairman. We've had discussions, but they're not really going to accommodate us. So I just don't know how to go from there.
That's a great, what county are you in? My department head works with the county records officers. I'm gonna see if he can talk to them about it.
Yeah, we use Hanover County, and they do have, I mean, they have a great IT department, and they have they utilize, I forget the name of the software, but they have a really great software system to pull up records. But at the end of the 5-year lifespan, all that stuff goes away irregardless.
In that case, I would assume that the county records officer will be handling those destructions. But I'm going to check with Chad about that.
Okay. And that doesn't cause us any issue if there's, like, say, there's correspondence that we're supposed to keep indefinitely, and they destroy them automatically after 5 years. That does not cause us the problem as long as they're the ones reporting it.
Yeah, and there's the only correspondence that's kept indefinitely is usually chairpersons or agency heads. I can't imagine that y'all would have a lot of long-term course, but just even keeping emails for 5 years, that's way too long.
Okay. We have another question in the chat box from Megan Dalton in Shenandoah Valley Soil and Water District. If the board member is the approving authority, how do they approve the destruction? Are their emails loaded into the system so they automatically receive the email requesting approval? I don't know if Megan has ability to talk and wants to elaborate or not.
I think I know what she means. The person who fills out the form initially, the form creator, they will input the email for the approving official. And then that way, once the form is submitted, it will go immediately to the approving official and whatever email was input into the form. The only one that is automatically generated is that of the records officer.
Perfect. I think that makes sense. Thank you, Megan. We have 2 more questions in the chat box for you. I know you showed and I screen shared the electronic versions of these forms, but we've got the question of, do we continue to use the paper form until November 16th and just use this as trial and play until that point?
Yes, you can submit paper forms with wet signatures until November 16th, or you can submit scanned forms over email until November 16th.
Okay. I think I also have one other question in the chat box. Chairman emails are kept for how long?
That I'm trying to pull that up right now. It shouldn't be. Those might be.
Sheila, feel free to elaborate. I know I've seen a
Yeah,
couple.
I think I was under the understanding that chairman emails are forever when it's conducting business. It's not like it's a 5-year, it's a forever thing, like our board minutes. Am I wrong?
That sounds correct. I am trying to pull up the schedule, but
I'm pretty sure that's right. I just was trying to clarify if you have something that's going to wipe off of your server in 5 years, within 5 months or whatever, what you need to have that download in an electronic file someplace and keep it, or otherwise print it out and keep a hard copy. But I wouldn't want to do it that way. But
yes, you're correct that chairperson correspondence is permanent. So as she was saying, it's probably best to download those once you can in a CSV or PDFs and either print them or retain them on your own separate hard drive.
Well, we haven't been doing that at Hanover Caroline. So we've just been, truthfully, we didn't even know that all the emails went by the wayside after 5 years. So I guess we just start from here.
Yes, better late than never.
Mm-hmm. I think I've captured questions in the chat box, but if there are others that want to ask a question before we wrap up with Miss Alexander, this is certainly your opportunity to engage on anything records retention. I know she has emailed me just before the call the links to those forms and a little bit of information. I will send that out to the group as a follow-up email along with Terri's presentation you'll see next. I always feel like I need to give a longer delay on Zoom for folks with questions, so I'll give it another moment if you've got anything records retention you still want to ask. I really appreciate the Library of Virginia staff and folks staying connected with districts, providing us the resources, and even joining today, Ms. Alexander, with all the details and information to ensure that this is an easy transition for our districts. So certainly not the end of the conversation, and I appreciate you being a resource for folks. If all right, I will send your contact information out along with the follow-up email just so folks have it too.
Okay, great. Thank you for having me. And if you guys have any records retention questions, it's my job to answer them. So don't ever hesitate to ask.
Thank you.
Okay.
Thank you so much.
Thank y'all. Bye-bye.
All right, Susie, you have quite an agenda still, and Terri is on the line. Any transition or anything, but while I give and ensure Terri has co-hosting ability so she can share her screen.
Okay. So hi, Terri.
Hi.
So Terri's going to be sharing with us today some of the new rules and regulations related to COVID. She's prepared some really great materials for us and some documents and templates that I know Kendall, after the call, will have on the association page for you to reference. But I know Terri has a lot to cover with you, so I'm going to turn it over to her.
Terri, are you interested in starting with the question that we had for polling?
Oh, sure. Oh,
Just tell me when, otherwise, okay?
I'll tell you when. Yeah.
Okay. All you.
Okay, I'm going to share my screen, and this is the first time, so you'll have to be a little patient, maybe. I'm usually a participant. Can you see the screen?
Yep.
It says person. Good. I'll start from the beginning then. All right. This is just the PowerPoint slides you see are going to kind of be more of just a checklist and stuff to keep it on track so that I remember, don't forget anything. And then what I thought would be more valuable after talking with Susie and Kendall would be to actually go through, highlight the documents that we've already provided and that you'll be getting in addition to some of the documents that you can't link to through the presentation. Just starting with the presentation, there's a reminder that all of these will be posted by Kendall online, so you'll be able to re-access them. Anything you see here where where you go down, like there are a lot of new posting requirements. And some of them are the temporary things, some of them are signage, some of them are reminders. I'll try to remember to talk through all that, which is why I've set up the PowerPoint this way. But starting with poster versions, there's a lot of changes, like if you're familiar with the New Families First Response Act, that's the one that that coupled with these two, the emergency family and medical leave expansion and the paid sick leave, they're the ones you've heard from Congress that expands coverage for the paid sick leave for 2 weeks and will now allow under the FMLA the child care provisions. So these are posters that are all required to be posted in your workplace. So wherever you guys have that bulletin board with like your minimum wage and your OSHA and all your other things, these are just posters that need to be either updated or replaced or make sure that they're there. Anything that's got the underline that's in this kind of orangey color is a link so that you can go and print that right out. It's readily accessible to you. The feds or the state has provided documents. Anything where you see this little asterisk is, oh, let me go back. Anything where you see this little asterisk is something where they've given us what's required to be in a posting, but haven't provided us with a poster. So I took the information of what is required to be posted and provided and created a separate document for you. And you will see that in the attachments that you'll be getting from Kindle later, and that you will also see on the VASWCD website. So these are just pretty much all the new ones. OSHA has new ones. They also have a new 10-step poster. It talks about how to deal with all of this as an employer. The Virginia Rights Act as amended by pregnancy and childbirth. That really just folds it under to force folks to recognize childbirth as no longer those maternity policies or no longer different from FMLA. I'm not sure where or how that was still happening, but somewhere, somehow, they felt the need to make sure that folks understood that pregnancy is covered by the ADA if they need a reasonable accommodation, such as light duty, and it's covered under the FMLA leave for the time off for childbirth, and then anything like the appointments, the follow-up appointments, the prenatal care, those kinds of things. So they've just felt the need to clarify that so that folks are properly treating pregnancy and childbirth and the related conditions and appointments and things properly under FMLA and properly under the ADA. The Values Act as amended is the one that has extended the non-discriminatory protections to things like your traits, such as like if some folks need to wear beards to help with acne, braids and different things or different hair characteristics, as well as sexual orientation and gender, I forget what they call it, gender association, basically, however you gender identity. So that addresses protecting their rights for that. And then Virginia also extended their non-compete law under, these were all pretty recent actually, extended the non-compete law to much lower wage employees because apparently I don't know that most employers use non-competes anymore because they're really not enforceable. They're really just kind of a scare tactic, but they've lowered that threshold to, I believe, about $35,000. You can't issue a non-compete law. So that's basically, there's a poster that needs to be posted about that in your workplace. And you'll see that has an asterisk. That's one of the ones you can get out of the files rather than online. More new workplace posting requirements. These are really COVID specific. These are things like, what's your pre-screening practice at the entrance or all entrances to the office? Because now one of the requirements is you need to adopt one of two provisions to screen and make sure that somebody asymptomatic, well, do your best to screen, but they're trying to screen for symptoms basically and temperatures. Asymptomatic folks are kind of going to slip by and they're the highest risk. But pre-screening is now required, so you're going to have your poster at that, as well as a sign that you'll see included in the packet that asks people to pre-screen. So if you've got a visitor or a landowner stopping by, it's just posted on your door. It says, "Stop. Do you have any of these symptoms? If so, call. And if not, come on in." Then your signs and symptoms poster, they've pushed that out to an employer as well. You've got to make sure that they're posted in the workplace as well as distributed to the employees. And there's a poster that you'll see this underlined that you can print off. Risk factor awareness posters. There's a risk awareness that I've created out of their requirements, as well as you'll see what are the health factors that make folks at high risk, and you'll see that becomes a little bit of criteria when we get to the assessment portion. Asymptomatic and pre-symptomatic, they have posters for that so that you can just kind of be aware that there really are no pre-screening precautions that you can take, but under different circumstances, how your face covering can help address those issues. So they want folks to be aware that when they're required to wear face coverings in public, basically whenever they're not in their office, their secured office space, that this is how you protect yourself. You put your mask on, and this is why. It's asymptomatic, pre-symptomatic. Safe and healthy workplace practices is also another one. That covers a pretty wide range, so I've created one for everybody. The hand washing, hand disinfecting. I liked that some of the PowerPoints we were going to with the different agencies as well as the different professional organizations, and then we're calling it hygiene, and it just is kind of an easy umbrella for what does the person need to do as well as the workplace, because there are requirements for hand washing and requirements at the end of each shift, what needs to be cleaned in the office, in addition to your cleaning crew that's going to come in and, clean your bathrooms, wipe down your sink, wipe down your surfaces. There's still end of shift requirements that employees need to take at the end of their shift whenever they exit the office. So that's all included in that. Social distancing is a really important one because that's required for our employers to put down markings on the floor, and those little dots, if you think you're going to have a line somewhere, they're really handy to put. I mean, we're really small, but if you have two people in the office who have each in an office that can close the door, and they're not going to be close, but they might, use the kitchenette, at the same time, make sure that you've got a dot in your kitchenette. If you've got like a one-seat bathroom and somebody might stand outside, make sure you've got a dot on either side of the door at 6 feet kind of thing. So they're requiring a lot of those social distancing dots, or it can be, and you don't have to purchase or print dots. It can be as simple as a piece of tape on the floor that just indicates stand here, So it doesn't, you don't have to spend a lot of money on that. The face coverings, posters, and how a lot of folks recommended that, and organizations recommended that you also include the how to wear it properly poster. So I've given links to those. Occupancy limits, different from your building limits or your office limits. This is where, as part of your workplace assessment, you need to be able to determine, can people maintain that 6 foot of, basically safe space, pretty much at all times in your office. And if they can't, you need to think about how many people can you safely accommodate while maintaining that 6 foot distance. So that's the occupancy limits that you're going to need to establish. Whenever you can, they're requiring that you limit it. You can shut off access. They're requiring that to block access if somebody doesn't need to get into it, and then issue keys if you can. And then the other thing is to limit the access. Let's see, traffic flow, so that folks aren't passing each other, any more than necessary, even though that would be considered a brief contact. Traffic flows wherever you can so that folks aren't running and bumping into each other. The distance markings, and then there are a bunch of reminder posters that are required to be posted.
Terri, before you move to your next slide, we have one question in the chat box. Just to clarify, do districts need to post all of the posters listed on this slide? Are they required to, optional, or just recommended?
They're all required to. These are all out of OSHA and VASH. So those are those requirements. They're not the CDC requirements. They are OSHA and they are VASH.
Thank you.
VASH is the Virginia Occupational Safety and Health, run by VDALI. The next are the new policy requirements, and these come out of the Virginia statutes, as well as some of them are VASH related or OSHA related. And there's a checklist in the handout, so I'm not going to run down those. I think the COVID stuff was a little more important. These are things that you can either reach out for or that I kind of covered in the other changes. I want to get to kind of the meat of the documents, which is why I wanted to just go through these as more of a reminder. Everybody does need to implement the Emergency Family Medical Leave expansion. That's the one that expands the Paid Sick Leave Act. You also need a tracking tool. And if you look at the file that you'll be getting, it has compiled in the title. All of that's prepared for you on pages 8 through 10 of that PDF. So, as well as a lot of information around that. The new hygiene policies for personal and workplace, they include hand washing, cleaning, disinfecting for the duration of the pandemic. And really you could create one new safe workplace policy, which I heard recommended actually only twice, and I thought it was a really good idea. So I've created the forms around that, and you could create just one policy that includes the mandatory hand washing, cleaning, and disinfecting at the end of each shift, your social distancing requirements, your face covering requirements, the occupancy limits. They all have vehicle or requirements around vehicles. So if there's more than one person in it, you have to have policies around that. And then also logging contacts. So that is critical, because if you do have a positive test, you as the employer, it's also incumbent on you to make a few notifications to VDALI as well as the Virginia Department of Health, and they are going to ask for what the contacts were in the last 14 days. So in the materials that you're going to receive from Kindle, you'll see logs for that. And then I think Susie has probably the best log for the office log, so she's going to share that rather than what I've been able to find. And then the other thing that they're recommending strongly, and some parts are shall, employers shall, and some parts are employers should, but the best practice and the recommendations when you go to cut some of the other more law firm kind of webinars is that you kind of adopt one workplace flexibility policy and roll all of this flexibility that they're asking you to consider and work through and see if you can make it work into one policy. And you'll see there where I've noted what's required. I've already created one for you that rolls all that together, but that would cover any telework, that would encompass things like alternate work hours. So if somebody needs to provide childcare in the morning, could they work like 12 to 8 or 2 to 6 or some other alternative hours if they can't telework? Alternative work schedules, those are things where they, in all of the policies or the mandates, I guess, really, they're saying you need to minimize staff in your office to the extent possible. And that's why they're forcing you to think through your occupancy limits and things. That is where they're encouraging no overlap or minimal overlap of folks. So you'll see in the documentation when you go through it, what they're talking about as far as hours. Somebody work, if you need people to be in the office, they cannot telework. Have somebody work either like days. So I would work one day, Susie would work the next day, then Kendall would work the next day, then I would work the next day. So you come up with a rotation, or you could come up with a morning afternoon schedule or 2-hour increment shifts or whatever. Just get creative. And that's what they're really strongly recommending, just a hair shy of requiring. And then they're also encouraging everybody to think about a temporary paid leave policy that gives greater flexibility in allowing people to use annual and sick leave or pay or PTO banks, and how that can be used to cover time when they can't be working, you know, juggling kids in school and teaching from home and work.
Terry, before you leave that slide, can I ask two questions in our chat box? Does the emergency expansion of FMLA still end December 2020?
December 31st, 2020, yes.
Okay. And does notification violate any HIPAA laws?
Does notification, oh, to just employees?
I believe so. Deanna, do you want to clarify your question?
Yeah, if you notify those agencies that if someone tested positive in your office, you said we had to notify the health department or some other agency, and I apologize, I didn't catch that. Does that violate HIPAA laws?
When you notify VDALI, which oversees VOSH, and you notify Virginia Health, those will not violate HIPAA laws. But your notification to contractors or anybody who's been in and around that person, and your notification to other employees has to be very generic in nature. So you would just say something like, you know, the Henricopolis district has experienced contact with a positive individual within the last 14 days. And you don't give out names and things like that. So you just give very generic notifications that if you've been on premises, you'll want to either self-quarantine or self-monitor for symptoms, or reach out to your healthcare provider for proper guidance.
Thank you.
You're welcome. Let's see. Oh, these are required. You have to implement a sound notification and return to work policy. And those are very specific about how they can return to work, as well as they're required to notify you as soon as they're aware of a positive test result, or they are aware or suspect contact with an infected, known or suspected infected person. That was tough. Sorry about that. So they'll let you know, and then you can decide, you know, the isolation, you'll want to get them out of the office. And I've given you the procedures that are specified in the various OSHA and VOSH documents. Your notification, adhere to HIPAA, it has to be that very generic one. Notify others who've been in the workplace. That's why your logs are going to be so important. Who's been in the office on what dates, so that you can give that 14-day window notification. The VDALI, you only have to notify if you become what they call a cluster of 3 or more. So if you have one this month and one next month and one the month after that, you don't have to notify at that point. You basically, if you have 3, think of it as a concurrent, almost concurrent kind of thing for the VDALI. Otherwise, you just have to notify the Virginia Health Department or Department of Health. I think I've got it both ways, VHD and VDH. It's the same thing. You also are required to notify the building owner. You don't have to notify anyone else in your building, but you do have to let them know, and not who, but you're required to notify the building owner that your operations has had one person and you're located on this floor. And then the rest of the responsibility for notification transfers to the building owner. And then if you do have positive cases, don't forget that you're required to report them on your OSHA Form 300. And then that policy is also required, like pages later in some of the documentation, to include a return to work policy, which they're very specific about. And you'll find that on pages 46 of one of the documents you get.
That document that she's referencing with page numbers is the one that you got attached to the email yesterday. I'll send it again afterwards, but we have one more question, Terry, before you shift to the next slide. How do you deal with a positive test when the employee was in the field with a client? Wouldn't you be directly indicating the person? Sharon, do you want to clarify?
If it's a small office, yes. But your responsibility as an employer is to make that generic. You've had recent contact within the last 14 days with an individual from the district, and you're advised to self-monitor and reach out to your healthcare professional. Yeah, it's gonna, with small groups and specified roles, it's gonna be real apparent, but your responsibility is still to not disclose that identity. So yeah, it's gonna be obvious, but your responsibility is still to be generic. Did that help?
Yes, ma'am. Thank you.
Okay. Temporary workplace requirements, implement the sound pre-screening, which I mentioned earlier, I've already included. You've only got the two options that are approved, self-screen, and that needs to be generic, so you're not creating a medical record, and pre-screen by the district, which also needs to be generic. I've included the one that we're using, the pre-screen questions at the county, because I know those have been vetted. And then the self-screen, which I know had been vetted, I believe I got that one from SHRM. I'd have to go back and check, but both of those I know have been vetted, and they're generic, so they don't create that HIPAA record. It just is something that an employee can go down a checklist and say, yep, I was in the office today, I don't have any of this. The processes are outlined again in that document, and we've pretty much covered that. If you do need to send somebody home exhibit because they are exhibiting symptoms, you can do that. You can prevent them from entering the workplace. And you can require a negative test result prior to them returning to the workplace. You can't request that they get or require that they get the one that tests for antibodies. So that's the serological one. And you can't require them to pay for the test, the positive negative test. So you'll have to, work through that. I would think through your workers' comp insurance, you have a board or a panel, or there are community things where they can get those. So in worst case scenario, you reimburse them for that. Let's see. Here's the VASH. This is the highlight of the one that they dropped at the end of July. And then sent, I think we got that closer to the end of July for the actual printed documents. The requirements under the new VASH standards are the workplace assessment, the position assessment, investigating and implementing appropriate controls in the workplace, because the goal is to reduce the risk of exposure and to reduce the risk of spread. Mandatory information and posting requirements, I've already given you all those. Workplace flexibility, they stopped just shy of mandating that. It just says you shall investigate these options, I think is how it puts it. The documentation requirements, so that once you complete the workplace assessment, you will need to post that. So you'll see I included a signature line on a form that I've created for you. That does need to be posted with the other documents. And then there's a lot of notification and training requirements, because they've kind of pushed down to the employer responsibility for educating their employees about COVID and the requirement to force them to comply with, face masks and hand washing and hygiene kind of things in the workplace. And then the anti-retaliation provisions, that's just section 110 of our Virginia code, and those still apply. It's the reasonable person standard still applies. So, if they still have, you can't terminate somebody for refusing to perform a job duty if there is a reasonable expectation of risk or death. So it's just the same, it's the same provision. Let's see.
Terry, before you head on, we've got one more question, I believe, from Ann Coates in the chat box related to that slide. I'm not sure I fully understand it. Ann, do you want to clarify?
Yeah, because I couldn't even begin to type it. Terry, you're talking so fast for me. I know this is all like common language for you, but I'm trying to catch up. So
I'm sorry.
You said something. Well, I know you're such a wealth of information. You said something about when they sign the contact form. Did I miss something where you said something like, don't put the name because then you're breaking HIPAA? I kind of missed. There was something you said about, assumingly the contact form, we would have the person's name and what time they came to the office and why they were there, etc. But did you say something about not having the name written on a form, because then if they say yes, they have been in contact with someone who's had have they just, I guess I was a little confused and maybe I misunderstood.
Oh, that's okay. The logs that you're going to keep are so that you can go back and make those 14-day notifications to folks who have been in your office, whether it's employees, landowners, or the public. So you will need your employees' names on the logs and who they interacted with so you can make those contacts.
Sure.
So that you can totally collect. But when you're making notifications, that's when you cannot share names.
Gotcha. Okay. That's
Say that you've had contact. Yeah.
Yeah, you'd said that earlier, and then for some reason I thought when you got to one of the forms, it was something about, so I guess question I have then is when we have a log that when someone comes in, they sign in and they say, well, they're there and they're there to work. Mostly it's just staff. We don't have like a separate section for who they're interacting with in the office. I think we just assume that whoever was there that day. Is that sufficient, or do we need to have a separate column that says they interacted with, you know, one staff member and then another staff member, or do they just, can we just assume that if they've been in the office, whoever was there that day has interacted?
You can make that assumption, because what you would do is you'd notify whoever was in the office, and you don't really need to know what the level of interaction was, because
Gotcha.
mission could be that, 1 minute after you closed your door, I went and touched the copier and it hadn't been wiped down. So that's how I picked it. And then I bit my nail because I'm a nail biter, and so, so no, you don't need to go to that level of detail on your logs, because there are other, there are ways that somebody could have sneezed, as they walked past the copier, and then you use the copier and they didn't use the copier.
Well,
so there's all kinds of weird scenarios.
Okay, yeah. Our assumption is if they've come in the front door at all, then they've interacted to some degree, even if they stayed isolated from each other. They've, just like you said. So, okay.
Accurate assumption. Yep. And the name, I don't know if this was confusing at all, but their name would be on if they self-screen and say, no, I don't have any of this today, and they drop it in a box somewhere just so you have record they were in the office and they were okay to be in the office. That does not become a medical record because their name's on it, because the questions are generic.
Okay, well, so maybe that's why I got, so when our form has a column that says, did you self-screen? And there's a poster on the table and on the wall that says, here are the things you need to self-screen for. Do you have a fever? Have you been, and then they check yes or no if they have self-screened.
Perfect. That's a great solution.
Okay. So
you don't need a form. Yeah.
Okay.
I'm gonna, for those who don't, sorry.
You just need some sort of documentation that indicates they self-screened. A checkbox at the end of their login is a great way to do it.
So for those who don't have that in place, in the booklet that was emailed, page 32 is that job-related contact log example Terry's been referencing, and on page 44 is the self-screening form she's been talking about. I have a couple other examples from Loudon in terms of contact logs. If Anne, you want to send me yours also, I will not only be posting all of the materials on our website and sending you a link, but I'll be following up via email by tomorrow with all of this information. And I'll post some of those other examples if you have a contact log you want to share with the group also that might be a little different.
Yeah, Anne, sounds like you have a great one.
I have.
I'm happy to send it.
Yeah, that sounds good.
32 of your handout. Sorry, guys. I'm learning, and apologize for talking over people on Zoom. It's so hard not being able to see your face. I think I see one extra question from Keith Burgess. For the contact log, Terry, page 32 of your handout, what kind of information for contacting should we request? Just having a name, date, time, duration, and location won't necessarily help us contact someone that just walked into the office.
You should note whoever just walked into the office, because you don't know if they, you're still obligated to notify that person. So yeah, whatever those criteria you just called out are fine for tracking contacts. But yeah, if somebody walks in just for a minute and says, oh, I'm in the wrong door, and you don't catch a name, they realize they're in the wrong place. There's not much you can do about that. But if they come in and you interact with them, and you can ask their name and how can I help? And then that way you have something to go on.
Terry, should you be asking for phone number and address?
I don't know that I don't know that I'd go that far for something that brief. But you would have to provide their name to the VDH, and they would track down all that information if it becomes positive. So I don't think that you'd be obligated to that depth for somebody brief, because the VDH is going to do all that on their side of the house.
Another question is whether or not this should include deliveries like UPS, Amazon that are coming into the office.
Yes, those should all be converted to contactless already, so they really shouldn't be in your office, but you should note if you received a package that day, so you can let your delivery sources, your suppliers, your vendors, whatever, know that on this date, if they had personnel in your office, you became aware that there was a positive case. So you just have to note there was a delivery. Then once you notify that company, they'd have to track down who it was.
I've got one question in the chat box. Sharon, I apologize, I missed it earlier. I don't know if Terry's going to know this one, but maybe at the county they are handling it this way. Can the district dispose of a daily log after 14 days? Kind of a records retention question.
Oh, your obligation is for 14 days. I don't see why you couldn't. I don't know. I don't really have an answer for that. I'd have to check and see how we're handling it at the county, the logs.
Thank you.
Terry, this is Deanna. A lot of districts are co-located with USDA, and some of the offices are closed. Ours are closed to the public. But when we start to reopen, I don't know if they're following these things. Does the federal government have to, are they required to post all this stuff and do all this assessments that you're have lined out?
I would think, because the VASH stuff all applies to all employers operating in Virginia. So I would suspect so. Sometimes there are special carve-outs for the federal government. I'm not aware of them for VASH, but that's not an impossibility. And also the other thing the federal government loves to do is carve themselves out of things that they require of other employers. That happens a lot. But I'm not aware that there are carve-outs for, I'm not aware of carve-outs for that, but I haven't pursued it from the federal perspective, just from the public sector perspective.
I mean, we can't even get folks around here to wear a mask like they're supposed to. I'm not talking about district staff, but other staff that are in this building.
Yeah,
just
a lot of
event. Sorry.
Yeah, unfortunately, that's about half of our population. So it is a struggle, which is why we're still where we are, now with it lingering, I guess.
Question for Terry and others who are co-located. If you've had this occur, are federal partners required to inform us if they have a positive test, especially if you're co-located?
Yes, and they are required to notify, and they are required to notify the Virginia Department of Health. So if nothing else, the Virginia Department of Health would be reaching out to you. Or Health Department. I always get that backwards. I'm not sure which it is. Let's see. Oh, the requirements for the assessments, and I'll show you what, and you guys feel free to modify these however, but what I did was I took and all of the VASH regulations here pretty much paralleled the OSHA requirements for assessments, because OSHA's published their own assessments. So I would think OSHA would have to apply to your federal co-located persons, because OSHA applies to all employers. I might have to sneeze. My allergies have gone crazy today. Sorry about that. These requirements, I just kind of summarized them here, and then you'll see them. I'll switch from here over to the attachments. It basically, you have to do, look at the work environment, the office and the personal space, and whether or not they can distance, because distancing is a requirement under VASH. The job duties that they're performed, so there's considerations for, are they in a communal situation? Do they have an office door that can be closed? Do they have 6-foot cube walls? Are there barriers that can be put in place? Those kinds of things. Duration and frequency of job-related interactions is a consideration that has to be assessed. The contact with shared work surfaces and equipment. And I don't know about you, but I don't know anybody where any place anymore where everybody has their own printers and copiers and stuff like that. So that's definitely in most workplaces. Common and shared areas access, that would be, you know, everything from lobbies to file rooms to kitchenettes to bathrooms. If there's a vehicle that's shared, so make sure there's just one person in it, or if there are two, they have to wear their face mask at all times. And then the level of community spread wherever you are. Medium risk, from the webinars and things that calls that I've been on, pretty much the consensus is most workplaces are going to be a medium risk. So I've just given you the definition there. And then low risk, there will be not necessarily workplaces, but there will be positions that are low risk. And the example that everybody keeps giving, so I'll give it too, is an accountant who can come into the office and basically close his door and do his accounting thing. So that's a definition of a good low risk job. Minimal interaction, you know, kind of thing. So that, I've just given you those two tips. Most workplaces are probably medium, and the consensus is some jobs will be low risk, but they'll be the guys who can definitely just be in the office, minimal contact, you know, just sharing the bathroom, those kinds of things. And you can implement different practices to provide safeguards, like keep your door closed. Let's see. I wanted to switch to the documents at this point because Susie and Kendall liked what was in there and thought those would be more important. And I tried to talk less so that I could spend, they said an hour, half an hour, like just yakking on these, and then half an hour walking you through and getting questions as you go. My contact information, I've re-provided that. I'm still a work at home person. So I'm teleworking and pretty much feels like nonstop. So I've given you my work address so that I can stay more on top of this. Not to say you can't get buried in my work email. So if you don't hear back from me in like a day or two, pick up the phone and give me a call, or just resend another email. But I should be able to get, I'm so sorry, I have allergies. I should be able to respond relatively quickly. Let's see, I'm going to stop sharing this screen and switch to one of the other documents. Let's see, share screen. Let's see which one this is. This is the, wait a minute, let me exit that. I'm not sure which screen I'm on. I'm sorry, guys, I'm new to this sharing stuff.
That looks like it could be the document that I emailed out, the 47-page one with starting with all. Does that help you a little bit?
Oh, okay. Do you see me moving the screen?
I don't. I've got the COVID-19 emergency temporary standards and requirements. Oh yeah, you're making it a little bigger.
Okay, good. Okay, I made it really big?
Yep.
Okay, good. This is the one I've gone through and tried to provide checklists. This is the one out of VASH. I thought I'd start with that one. It goes through and it's just kind of a checklist of all those things that were in the PowerPoint and things to kind of consolidate that 47-page VASH document, because there's a lot of repetitive language in that. I love that as an HR person, but it weighs most people down. That's just a checklist. I'm not going to go through that. I've already talked through that with my slides. What I really want to get to more is, here's an assessment that I created based on some of the ones that I've seen. And basically it's based on all of the criteria that I've gotten, either guidance through webinars or the other things that I've been through. And then it's also stuff out of VASH and CDC and OSHA. So our very highest risk is folks who are first responders. And, you know, we kind of think immediately that none of us are going to be very high risk, and we're probably right about that. But the consideration that we need to think about is, do we have folks who work for us who are first responders? In a lot of our rural areas, a lot of those localities are volunteer EMTs and volunteer firefighters. So that's what's called an unknown risk for the workplace. You don't know what they're going to encounter, and what safety provisions, and they might have, somebody pulling somebody out of a vehicle could have pulled their respirator momentarily, got that in or whatever. So those first responders, if you have those volunteers, could be a high risk for your workplace, but wouldn't overall make your whole workplace. So you'll see that folks who work a second job, all of these things, you'll see they decrease as you go through each level. But they're the scenarios that employers were forgetting to think about because, well, I'm not a healthcare facility, or I don't have any first responders, but you may have volunteers. You may have folks who volunteer at nursing homes or volunteer at hospitals and things like that. So they want you to think about what kind of risk is being brought into your workplace. So you'll see that just transitions down through the levels.
Okay.
Let's see. Tell me to speed up or slow down too, because I just feel, I get so excited about this. I want to share it all. And I know I need to kind of consolidate. If they have children, depending on whether they're just being cared for in the home or if they're out in daycare, whether or not your employees spend the majority of their time interacting face to face. And some of the things that might change as we go along, we might have to repeat an assessment for position level, which we'll get to in a minute. But if right now their offices are all closed, which is a great and right thing to be, but as we open up to the public, if you're a space that gets a lot of foot traffic, you would need to go back and reevaluate once that foot traffic comes into the office, how much, impact there is. It basically walks through then your indoor environment, your vehicle, whether or not you can social distance. It even goes into, they ask about your air handling, if it's uneven or dysfunctional air handling. And it even goes as far as to say, I think that's in the OSHA one, that if the air is blowing directly on an employee, they have to wear a face mask while at their desk. So I don't know if you could install a diverter to make that not blow on them, or, there are things called, shoot, I lost my word. You can use control measures, engineering, administrative, and then work practice control measures. And I'll walk you through what those are. But and you'll see that it scales down. So you have one or no employees as first responder, one or more, and then it goes down. It's pretty much the same criteria, but at different levels. So you don't have any employees that serve as first responders. Nobody works a second job. Nobody volunteers with the general public or in a high-risk population. So you'll see how that just scales back through the criteria that they've set out under those VASH and OSHA regs.
Terri, Terri, it's Keith Burgess. I'm gonna Kendall stepped out for just a minute.
Okay.
But on these forms, I guess everybody's question seems to be is, if you check one, are you in that category, or how many do you check before you say, yes, this is high risk, medium risk?
You'd want to go through the whole one and through all of them and then see which one has the majority. And if you've only got like one firefighter and he falls in all of them, then I would say probably your best bet would be to come up with what they call administrative controls, and you would want that person to work from home or work alternative hours. You could control that with a measure if you just have like one person who works as who volunteers as an EMT. So it kind of depends on, here's our assessment, but then the second part of this is we're going to take the information and look at what engineering controls can we put into place, what administrative controls and what work practice controls, what kind of flexibility do we have with keeping maybe that person off-site if they're an EMT, or maybe they're the only one who comes to the office and everybody else teleworks, or they just take one day and you clean after them, so they could come in and do their work. You've got lots of flexibility in how you respond and manage to that risk. And so what your opportunities are for mitigating that risk is really going to drive your end category as much as these determinations. These just lay the groundwork for thinking, okay, this is what I have to deal with. What can I mitigate? And then whatever level you're mitigating, you've decided you got to mitigate against, you also have to publish your control measures you're implementing, so that they'll go hand in hand. Does that make sense?
Hey, Terry, this is Ann Coates. It looks like Amy had a question and Deanna had a question.
And Megan, yes, this is Shannon. I'm getting ready to go over those questions.
Oh, okay. I thought since Kendall walked out, sorry.
No, it's okay.
Oh, it's okay.
Yeah, Kendall had to step out for a minute. But Megan had a question saying, so are you saying that you think the SWCD's jobs are assessed at a medium risk, sorry.
I think our workplaces are probably medium risk because that seems to be the consensus for most workplaces. And on the VASH, the webinar that centered on the VASH was, that was the consensus that most workplaces will be medium risk, just because there are, I guess, unknowns and only so many controls that folks can feasibly put into place. But jobs could be medium or low or high. I mean, it depends on the job. You'll see the criteria here in a minute for the jobs, but your workplace is going to be one rating, and then each position that you have in the job in your district could be a different rating. So you're really doing two sets of assessments.
Something else that was asked was, where can we get access to the required training, and can we get this added to our COVLC trainings?
I don't know what a COVL training is.
COVLC. Megan, do you want to elaborate on that?
This is Keith. The COVLC is the state website for trainings.
Oh, okay.
Kind of heads that up.
Oh, okay. I know the county has a lot of, Henrico County has a lot of how to wear your face mask properly, how to don and doff and all of that on their website. I would think if we create, and this is what I just haven't done, that's why you'll see on that one page back at the beginning, you'll see that it says training materials to come. I want to make sure that we go through and we compile like a list of access that you can have your folks run through that training, whether it's a PowerPoint or it's click on the link and then they sign. You have to get an acknowledgement that they've completed the training. So I haven't worked through all of that yet to share the training materials.
Before I move on to the next question, Megan, did that answer your question, or would you like to her to elaborate some more? Okay. I'm assuming that her questions were answered. If not, just pop back in. Deanna had a question. What about employees who have children in school or attend daycare? Does that bump up a risk?
Yeah, you'll see that's listed in there. So what you'll want to do is, can they telework or can they take some kind of alternate shift, alternate hour? Yeah, that's factored in there.
Okay, and Amy had a question, and I apologize if this has already been asked and answered. How many items can you check in a risk category without necessarily falling into that higher risk category?
That's going to kind of come back to a little bit of discretion and coupling with the control measures that you're able to implement to mitigate risk. You'll definitely want to err on the side of caution is what everybody's recommending. If you've only got like the one employee working a second job or one employee as a first responder, I wouldn't go with a high risk category. What I do is would be note that as something that you've got to implement a control for, and then come up with how do you control those interactions. And maybe you can't, maybe you are a high risk, category. If the person has to be on site and has to be in the office to do their job. You could also get creative. They stress endlessly to get creative and be flexible and think outside the box on how you can respond to measures. So maybe everybody doesn't have laptops, but does that preclude them from taking a desktop home with them? In Loudon determined no, they could take their desktop home with them. So it really depends. It really depends on. Everything's a case by case basis. I hate to say it, but it really is coming down to case by case.
Terri, this is So I think this kind of ties back to something we were talking about the other day was, it's really going to be important for each district to have their own policy for how they're going to handle this type of thing. So I know that's something that we're getting ready to work on in Loudon, but so after you have these assessments done, that might be something.
I know Susie got cut off, but that might be something once you've done an assessment, you are more than welcome to reach back out to me and talk through where should I place this and then talk through what your options are. You'll see in here, I've given you a whole page of, I guess they're kind of recommended or suggested control measures. So it's not like you've got a blank slate. You'll see in the handouts, in the 47-page handout, there's a page of measures that you can think about implementing. And certainly if you want to reach out and give me a call, I will be more than happy to talk you through and help you with all of that. I'm going to just scroll past that and there's I've given us a signature page, because one of the things that VASH requires is this assessment get posted along with your actions taken. And I've given you like a sample document of actions taken as well, because they're pretty much the easy ones.
I just have a couple more questions before we move on. I'm so sorry.
Sure. Oh, that's okay.
There was a question, are these personal questions on the employee assessment form? That may be a little late. It might have been something else you were talking about. Anne is.
Yeah, no, I think it ties to this as we move into this next document, I think on the employee kind of questionnaire. A lot of the questions that we need to answer the workplace one are personal. Like, I don't have any idea if my staff is an emergency medical technician. I mean, we've got 10 staff members, and it's not as simple as me just calling up 1 or 2 people and asking them these questions. I guess I feel like, is there a form, or should we have a form that asks all these kind of personal questions, I guess, about their daycare situations and whether they're EMTs or not, and then have them sign that? Because I don't know that I can completely answer this without asking 10 people a bunch of questions. And I guess I'm wondering are some of these questions in the personal, in this employee version, or are we talking another document that is yet to be created?
No, I didn't create a document for that, because one of the things that are encouraged in OSHA and VASH is that employees be included in the determination process. So my recommendation would be that you would send an email and say, hey, we're looking at, assessing the workplace so we can make it as safe as we possibly can, look at all of the feasible measures to keep, you safe, minimize exposure, minimize risk, and minimize spread. And so, please email us back and let us know if you are an EMT, if you have a second job, if you have a child in daycare out of the home. Kind of just ask them to respond if they have that. And then that way you'd be covered as an employer, because you've reached out for the information. And ideally, they're going to want to work with you on that. And, and maybe if you have a policy against second jobs, you can say no harm, no foul. We're not going to take any action, but we do need to know to keep everybody safe. That would be my recommendation, would probably be the easiest way if you don't know if somebody's an EMT or something like that. Second job.
Know how many of those questions were, and you answered my question, which is I would want it in writing, not just as a conversation with 10 people on the phone all at once, because I would like it in writing. If someone says they're not an EMT, then I've got record of it. But there were other kind of personal questions in here, like about the daycare, and that's sort of where I guess I was wondering if there was a form that we could have them fill out, and I can create one. I just didn't know if there was something like that already existed.
I didn't create any, and I was thinking more of you'd have copies of emails saying, no, none of this applies to me, or, let me know if nothing applies, let me know what applies. Then you'd have that record email, but you could certainly, nothing would preclude a form just saying, we're trying to do an accurate risk assessment, and we need to know if anybody, this applies to anybody, and just let it.
Yeah, there were a lot of other questions like, public transportation. There was just so many different things. I knew it wouldn't be. Anyway, that you answered my question. Thank you.
Oh, you're welcome. Okay. Then the
Okay,
next,
I'm so sorry. A couple more have popped up real quick. Just one thing I wanted
Okay.
to mention. Sharon did say that, Sharon Connor from Hanover Caroline, that they received some training through the county. Each employee did, it was about 15 minutes, and then they printed a certificate stating that they had received that training.
mhm.
Deanna had let me see. Deanna had a question. What about, no. Sorry. I'm trying to get down here. Can you see? I
Yeah,
can't,
if
it keeps
districts
cutting it off.
do not adhere or comply with requirements, including assessments, training, what are the consequences? Is there a liability if someone gets sick? Could legal action result? And are there deadlines to have these assessments completed?
Break that one down. I'll try to not miss any part.
Okay.
Yes, the employees are required to comply, because once you issue the policies, they have to wear their face masks, they have to social distance. You can treat it as a disciplinary action, and you can follow your disciplinary policy if they choose not to comply. That is a public health risk, so you can require it, and you can discipline on it. Is there liability to the district? If you've taken all the good faith steps as a district and done everything, you know, basically that I've laid out and summarized for you, so to protect, my perspective is protect the district, and you're protecting the employees too. So if you've done all this and you as a district can show you've done your assessment, you've implemented your controls, you've posted everything you need to post, then they're saying that at that point you are not liable. You've met the good faith clause. I think there was more to that question.
Deanna, did we miss a piece of it?
Deadline.
Well, I guess deadlines, but I guess my question about complying with the requirements wasn't necessarily from an employee perspective, but from the district perspective. I mean, this is a lot of material, Terry. I commend you for putting all this stuff together. My gosh, I had no idea all this was necessary. It's overwhelming me right at the moment. And I'm thinking, I had policies in place, and you know, apparently they're not meeting these requirements. I'm going to try my best to do it, but you know, I don't know what the timeline is, and if I don't get it completed, what is the consequences?
There is no police that's going to follow up with you. So like the VDH and VDALI, and they aren't going to show up on your doorstep and start seeing, have you done this? The assessments were due August 25th, but honestly, we were still in webinars and discussing it, you know, in August. And I think probably most employers, unless you're a giant, large employer with lots of resources, are probably still struggling to catch up. The training is September 25th for employees. And so that's why I was going to go ahead and compile and see, you know, what resources I could put together for everybody to have free access to. Then you could just have folks sign off on an acknowledgement that I viewed them, read them, whatever. There is liability if you have, you know, depending on your employee population, there is risk and liability to the district. If you've got employees who think you haven't done enough and they think they have, you know, a reasonable risk and want to report you to OSHA or VASH, you know, that's obviously a risk, because then they're going to come out and inspect your workplace, and, you know, they're going to turn up and you're going to be on their radar, not just now, but for a long time probably. So there is risk to not complying if you've got employees sensitive to this and, you know, they want to do some reporting. Yeah, there's risk and liability. But if you've taken the steps and showed a good faith effort, and you've implemented, you know, feasible mitigating controls for the workplace, like you've put those plexiglass shields up, you know, things like that. You've put up your occupancy, you've put up your signage. Sometimes people are just defiant, and if they don't, you know, defy, you know, you're going to have to just sit down and have a conversation about disciplinary, and they need to comply. But if they get VASH or OSHA involved, yeah, there's risk and liability, sure.
Okay, well that's what I was wondering, because, you know, our board is going to have to be aware of all this work that we're going to have to do, and I that's one of the questions they'll probably ask is, well, what if we don't do it?
It depends on, you'd have to know your employee population. I mean, the country's polarized, and you'd have to kind of know your audience and your population, I guess. Yeah, there's risk. I'm not going to say there's not, but if you take base steps, you should be protected. And you could do it, the work is, you could spread that around, like you could do as the district manager, assess the workplace and then share that document and say, hey, have I missed anything? Or send the email like I had explained earlier. Let me know if there's any risk factors we're unaware with. No harm, no foul. We're not doing anything. It's like a don't ask, don't tell kind of thing. We're okay. You can tell, won't be any whatever at this time. You could do that as a district manager, do the workplace, and then share the position one with employees and have them each do their own, and then you review it as a district manager and make sure that you feel comfortable with it, and then have a discussion. That would at least share the assessment workload. The rest of it's pretty straightforward, just printing and posting and measuring, and it's going to take some time for sure, but it's not a long-lasting workload.
Thank you, Terry.
You're welcome.
The chat box got a little active there, and I want to make sure everybody had a chance for questions. Kathy Clark, did you have a question you wanted to ask? I see our district's required to have a COVID policy. Kathy, are you there?
Hi, can you hear me, Kendall?
Again.
I can now.
So we are in the same boat as Deanna. Brandon and I are sitting here listening to all this and looking through the 47 pages and are very overwhelmed by all of this.
Now, a lot of them are just posters and signs that you guys can print. You don't have to do any work. So it's not 47 pages of work. I don't want to scare you.
So like if we could go back to, I feel like I've missed several trainings or conversations about this in the past. If we go back to a basic 101 in all of this, are districts required to have a separate COVID policy, or is this a recommendation?
You are required to have the policies that I have listed for you. Yes, that is not an option. They're not recommendations. At this point, VASH codified those, and so did OSHA. Past the CDC stuff, so forget the recommendations.
So outside of this training today, where would districts have been informed of those requirements?
Just trying to keep however you would normally keep up with workplace law, governance of the workplace. Usually me, I share.
Terry has brought it up on a couple of our admin ops calls in the past, but never in this level of detail, and especially now that the state has passed some regulations. We do have on the COVID website too, as y'all have been sharing them, a lot of district resources in terms of other district policies, so you don't have to reinvent the wheel.
Right.
And I can certainly share the link to that along with all these other resources so that you can take a look at what other districts have implemented at this point.
And it sounds like for the training, folks who are under the county umbrella, if you've completed your county training, that probably already meets all the criteria, because I know the counties with the training, like I know we have Henrico on, the training that the county sent out ticked all the boxes, and that and the website that we were told to go out and access about masks and other things previously ticked all of our boxes. So we've got that one kind of easy. That's why I was going to share some of the Henrico and compile like a training document for everybody. So it was just click here, watch, click here, watch. It's not like testing is required.
Terry, this is Sharon Connor. I think those trainings do check the boxes, but if you end up categorizing an employee as either high risk or very high risk, then I believe those employees have to have additional training, and I don't know where you go from there.
If you reach out, I could figure out resources for you. I'd help you find resources. The training is different based on the level of categorization of at the position level, the document that I've got up now. They are different. So the trainings that I got is a little bit different than the training my husband got as an essential worker, which is different from what our police, fire, and public safety and detention folks all got as part of their training, because VASH does quantify what that training needs to include at, so does OSHA actually, quantify what that training needs to include.
Terry, this is Sue.
Okay.
So I know you and I are going to be getting together in the next couple of weeks to kind of work on Loudoun's policy. So I just want to say, you know, once we get ours done, I'd be happy to share Loudoun's, you know, with Kendall to put up on the association site.
Okay. Did that cover questions for now?
I believe so, folks. Your chat box has gotten a little busy. Megan Dalton might have a comment and reference you back to the Commonwealth's Learning Center. We can certainly follow up from the association side with Blair or Carl if they're not on the phone with us. I think Blair might have been about access. And
that'd be good. If there's a center like that, I wasn't aware of that.
This is Kathleen Sullivan. I had a question.
Okay.
I typed it in the chat box, but both of our offices, we have free office space through the City of Virginia Beach and the City of Chesapeake. Of course, they have all of the COVID-19 posters up, and we have self-check COVID-19 things that we follow the policies of both cities. However, our staff, they're still teleworking, but we still have to go in the office from time to time. Our board voted to follow the policies of the localities where we're located. So
That's
does that
great.
cover us, or would we have to do a separate thing? And I'm sure we probably have to do this assessment for our employees, but on a broader level, will we fall under those policies?
I would say that is wonderful, because if you kind of enumerate that you're going to adhere to all of the recommended and required policies, I would just state it as required by the, you know, state, local, whatever, local, state, and federal levels. You're going to adhere to the measures that your locality follows. That's great. I would just adopt that policy, and then just make sure that if they haven't posted some of the things like your assessment and some of your posters, must make sure they're all up to date. But it sounds like if they've got the markers on the floor and they've got, you know, posters and coughing and directional arrows and all that going on, you're way ahead of the game. That's wonderful.
Yeah, yes, they absolutely do.
Yeah.
And they're, both of the offices are closed right now to the public, but for the employees, they do have that down. And our board did vote to follow the policies where our offices are located, what they're doing. So thank
Sounds
you for
like
that,
you've
Terry.
Oh, you're welcome. Sounds like all you've got to do are just your assessments then. Sounds like you're in good.
Okay, wonderful. Thank you.
You're welcome.
Terry, I have one more question we might have missed from Carolyn Daughters. Was the deadline for compliance discussed? Did we miss an answer for that? Can you restate it?
Yeah, I can restate it. The assessments were in that bulky code language, July 28th, I think it was. And they were due, the assessments were due by August 25th, but how to get through that and what documentation could look like and all of that was still really busy in lots of webinars and meetings and things like that. So August 25th was for the assessments, the position in the workplace. The posting requirements, some of those retro dated to July 1st. Some of them are effective August 21st. It depends. They're just different. Just get those up just so that you have them. There's not really going to be anything penalty wise for those, but just make sure you get those up. And then the training is August or September 25th. So those were the deadlines, but everybody's pretty much in the same box scrambling on how to document, how to get all this done. How can I even find them? I've noticed that some of the HR suppliers and stuff signs are just becoming available You know, it took them a couple days, a couple weeks to get, you know, even all that available for people to purchase. And some of this stuff isn't even done at the state and federal level yet. They don't have even some of the forms created for folks to use. So you'll see where in some of this documentation you'll get where I took the standards that needed to be posted and went ahead and put them into a document that you could post. So yeah, everybody's working through it. Nobody's gonna show up and get locked up for it. We just have to be moving forward with a good faith effort is what everybody keeps saying. Does that get us to the position? Oh, I talked over. Do you want me to keep going?
No, if you have a few more things you want to cover, I do feel like I don't want to cut us short if there are still questions and a few items to make sure we've hit, because the chat box is as busy as ever for any of our trainings. So feel free to keep moving.
Well, the one thing I did want to share is that the position one, I would definitely get your employees to do one themselves, or do it and then you review it. And one of the cornerstones that kept coming up was the attach a copy of a current job description. So make sure you have current job descriptions that you've kind of used as one of the cornerstones of how you made your assessment for positions. And then the other would be the employee involvement, and then yours as far as job assigned duties as the employer. So it's kind of, I guess, a three-legged stool. And then you'll see it goes through the different criteria that was in that slide. Are they primarily indoors, outdoors? Do they have 6 feet? Don't they have 6 feet? And then it gives you, do they use shared surfaces? All of that. Are they co-located with others? That could be high or very high depending on, you know, people and some of the other criteria. The other thing I wanted, then there's the position duties, and I've broken those down. The only real position that I can think of where you might have to come back, well, 2 scenarios. One, you would do this based on being in the workplace. The majority of that, because the expectation is to get folks back in the workplace. But if you, so that should pretty well be covered. But if moving, when you transition back to the workplace, you've got folks who get a lot of traffic and things like that, you might have to reassess this if you didn't do it on that perspective initially. If your offices are closed and you said, no, they're not getting any foot traffic, you know, when you reopen your offices, you might need to rethink that. The other thing is that if you've got people out for some reason, somebody went to a concert and then they found out that COVID was at the concert and now they have to self-quarantine for 14 days. Somebody else has to pick up their duties. Make sure you're, you know, having conversations around that. And then if their duties materially change, so you add or change duties around, say you've got vacancies, make sure that you're kind of looking at scenarios if you have to pick, you know, share communications. The other thing is your education people, the folks who are going into classrooms, they're the folks who probably are going to be the ones that you have to rethink, because you can do it now based on their duties. And if you project that they're going to keep doing it this way and they're going to stay pretty much virtual and all that, you'd be thinking about this one way. But if you do it based on how they're going to be in the office, you know, you need to think through what have the schools implemented. If they want, say your schools start to transition to open and they want your folks back in the classroom, you need to also reach out and find out what's the classroom doing. Are they limiting? Are they self-distancing? You know, is that putting our person at high risk? Do we want to do that? What are the alternatives to that? So you'll need to think, I think the education folks are the ones you'll need to think through most frequently and most thoroughly. Interactions, it goes through your scenarios that they talk about in all the regs, other position duties that you've, interactions that you've assessed, because there are things that, you know, I might not know. For instance, Pete's our financial guy. Well, Pete could lock himself in his office and be perfectly safe and be one of our low ones. So you could say, you know, financial officer duties and just list that there with no interaction with the public and things. And then here's some position employee. We tried to make it generic. It is a little bit personal, but you do, they do speak to considering when you're talking about your mitigation controls, and the ADA's weighed in, and well, as the EEOC is regulating that, I guess, really, that you want to work with your employees about reasonable accommodations if they have those underlying health risks. So it might, you know, I don't know how comfortable everyone is sharing that. I just let everybody know I've got RA, I might not have energy one day, and I might be a ball of fire the next day, depending on what my body decides to do. But everybody's not as comfortable sharing their health situations. So this one will probably take a little bit of tender, but it has to be factored into your control measures. So you might want to move somebody from a cubicle into an office and flip people around, or, I mean, there's all kinds of control measures. You might want to, you know, let them go ahead and take their desktop home and work from home because they can access everything they need to do. Or, you know, you may need to go ahead and extend plexiglass barriers around them, those kinds of things. That was all. The rest of them are really pretty much just ticking the boxes for the requirements. Both OSHA and VASH require that employees clean at the end of their shift. Here's what they require, they clean. Here's the personal hygiene that they require, VASH and OSHA, that all employees do. So I listed that on the other side and checked all the boxes because those are requirements. I put complete and sign and date this. So Kendall had a great idea yesterday that, and Susie had one too, where you could sign this acknowledging that they knew they had to comply with all this. And then you could just have them check a box when on the log that they had signed and cleaned what they needed to do versus getting a piece of paper each time they're in the office. So you don't, or aren't deluged with paper. Social distancing requirements. You are required to provide that 6 feet of space in the markers and things. So I just wrote this up so it's a checklist reminder. One for your employees to read and notice, and one for your whoever measures things off and determines that you've got ample space. That's just that. Then watch. Oh, there's more links to posters, but then watch how much we can skip. All these are just posters for your convenience. So you don't have to go looking for anything. So 47 pages are really about a dozen. See me go? And then here's the list of mitigating control measures. These are the ones that are specified in VASH and OSHA so that you have access to those. These are things you can do. And then that way you've got a whole list of ideas right in front of you, and you can also brainstorm with your folks. Workplace actions taken. Remember I said earlier that you had to, in addition to your risk assessment, post what measures you had taken. I gave you this as an example because these are all the required things. So we know you're going to do those. If you've done something else like put barriers in place, you can just type this or type whatever you guys want to do, add on. And then there's a log example, job related contacts. So they're in the office. You could just put office. Did they wear their face coverings, the other person? Those just generic logs. Susie has some good ones too. And somebody else had a really good one they talked about earlier I really liked. Here's your workplace flexibility I talked about, just combining them because that seems to be the recommendation that we're getting because they're all required and they're all kind of interrelated. Telework, flexible hours, teleconferencing, I just kind of lumped those into one. Then took a really great format from the state and updated it for the district and for COVID. So you'll see that terms of agreement and then any other terms. So if you need to impose certain terms, you know, you can have certain terms requested or proposed or required by the districts, and then signatures. And then here's a request form so that employees can request because you're required to document that. And then if they're going to work from home, just some tips, see, skip those. And then the frequently asked questions, you're required to provide frequently asked questions. So I called through a lot of the sites and just picked off what I saw was most frequent and gave those to us, and then just framed them around the districts, how they would apply to district. And then this is the self-screening, and you can see it's generic, which I talked about earlier, or if you're going to pre-screen, if you want to keep a log so that you know which employees were in and if they were screened, that doesn't become a log. However you want to pre-screen, I loved the one that had a checkbox and a poster at the entrance that to me was the most brilliant one out of all of these webinars that I've heard. That was, I like the best. So send that log to Kendall. Oh, you're required to have a policy for isolation and identification. That can be your policy right there. Return to work, you're required to have that. You're only allowed to require it on 2 bases, symptom-based and test-based. So that's, you can adopt that. And then here's the training checklist. As far as I know, it applies to the district. And this is the one I want to take more time with, make sure I haven't missed anything, and then also give you a resource for each one of those. And that's my last page. See, most of them are just helpful printed out.
Terri, you've compiled a lot of really great resources for districts, and I know the questions are not going to stop here. One just came into the chat box. On the model telework agreement, should there be a not in the following sentence? The district will be responsible for operating costs, home maintenance, or any other incidental costs associated
Yeah,
with—
there should be a not in there.
Just
good catch.
No problem.
Great catch, whoever that was.
Thank you, Amy. We'll make sure we get that changed too, and all the posting of materials that I'll do before tomorrow. We're also recording this video for folks, so we'll have that posted also in case you need to go back and just reference a question or two you had for Terri.
Yep.
So we had also designated time until around 3 o'clock for us to handle all of our needs for the Admin Ops Committee today. And we still have about 15 minutes in case there are other questions, comments, things you want to chat about when it comes to Terri before we disconnect with her. But also, in addition to what you might have related to this presentation, Terri, Susie, and I have still been talking about training in October 7th, I believe. Correct me guys if I'm wrong, for a personnel training, again, specific to Terri's topics that she can cover for directors as well as staff. And it would be marketed as part of our virtual training blitz, and we'd be getting out registration. It's up on our website already, but putting out a reminder to folks to register. I want to make sure that any input you have right now to Terri and Susie and I, as we work together to really frame what October's training looks like, that you offer input, but also to let you know the afternoon of Terri's willing to take off the entire day, October 7th, to help districts. In the morning for the training, and in the afternoon, you'll be having the ability to sign up for a time slot with her directly if you want to ask her one-on-one questions. So questions about today or any input for how we plan for October? Don't everybody talk at once.
Kendall, can you kind of give us an idea of what topics you're looking at for October 7th?
So yes, and I guess I kind of want y'all to think over if it needs to be revised. We originally had Terri coming to Graves Mountain as well as annual meeting to talk on personnel evaluations, job descriptions, and certainly we can focus it on those topics again if needed. But if there's something different now that you want to hear, or if there's something to elaborate on any of those topics, but that was the generic feedback we've gotten from folks already.
If this is going to be directed towards board members as well as staff, I don't know if maybe just a little mini version of all these requirements. Hopefully we'll have that completed by then, and there may be some new ones by that time. Does the group think that these need to be discussed more with our directors?
Or even a mini follow-up is what I'm hearing you say, Deanna, after you've had some time to digest the booklet and try to get yourself in compliance with things. It sounds like maybe just a check-in and update from Terri on these topics might be helpful.
Right, and then for districts that are co-located, I would just like to hear from other districts in that same situation as to how, are you working on something like this with your federal partners? And if so, how's that going? And maybe we can talk offline.
Why don't you call Reggie in Halifax?
What does she hit, like an early midlife crisis or something?
I think that's helpful. Make sure, please, that you're muted. There's some feedback happening for discussion.
Yeah, that's what Julie said, that he wasn't paying any attention, and she left him, and her family didn't inform her in this.
Guys, there's a lot of feedback. I'm going to go ahead and mute everybody for that and make sure you.
Hey, Kendall, you unmuted yourself. Or I mean, muted.
Thank you. Sorry, guys. Can you hear me now?
Well, we wouldn't know because they're all muted.
Yes, Kendall, we can hear you.
Thank you. Please, that's also a really good reminder to folks, and also a great test for how we do this with virtual trainings. Please make sure you've got yourself muted in the background if you have conversations going on. I see a few more things in the chat box I don't want to forget. Like I said, we have a good 10 to maybe 15 minutes more. And I want to make sure I'm capturing everybody. Sharon, I believe you might have had a comment. Did you need to elaborate? Hanover County just came out with accommodation documents.
Yeah, I don't know if this is a requirement for the CARES Act or not. I don't know if Terry's still on the phone or not, but they just released, I think it was yesterday, these leave accommodation forms. And this is not like your normal schedule adjustment that you would do with any employee, but this is strictly associated with the COVID situation, elder care, positive tests that come back for somebody, or even child care transitions because of the virtual learning environment. And again, I'm not sure if it's something mandatory for employee workplaces to have these, but I can modify the forms so that they're more generic and try to send those to you.
That would be great. I'd be happy to post and send out through our admin list resource for everyone. I think I had a few ideas for Terri and Susie: training needs, electronic retention of emails. How do we best do this? It sounds like some of you commenting in the chat box are saying we need more, just period, more of all of this for training needs. Okay. What else am I missing, guys? Or what questions do you have remaining for Terri? You don't have. Oh, go ahead.
This is Kathy Clark. Someone had asked the question earlier before we were muted about working with our federal partners. We're co-located. However, we've not been able to interact with their USDA partners since mid-March. Our internal middle door is locked on both sides. So we don't have access to our break room, conference room, public restrooms. We have a tiny bathroom that we're sharing that's about 5 foot by 5 foot. So I guess we're a little confused out here, is that we're not getting any real direction from our federal partners. We're not getting any from the localities. I was just messaging our county administrator, and they're working on an infectious disease response plan. I guess we're just, as I said earlier, we are so overwhelmed at this point of all this. I mean, we've been implementing just kind of more common sense practices. We're still closed to the public. We're still doing alternating work schedules. But as far as having all of this documented in writing in a policy form, it just seems a bit overwhelming.
A lot of it could just be adopted right out of those documents that I've given you. This wasn't the only document. There's 2 other sets of documents that should be pretty easy for that. And Sharon, I think probably what Hanover just came out with, are those the new FMLA forms that include the extended FMLA for childcare?
Yes.
Yeah, that's what just, I knew those forms just came out. Yeah.
So is that a requirement for us as well?
Yeah, you have to follow FMLA guidelines. And I wouldn't bother to alter the forms really at all, because it's just them adding, the federal government just rolled up the extended leave related to childcare into the family and medical leave stuff, because family and medical leave had not previously allowed childcare as a qualified reason to take FML.
Okay. Well, I can provide them to Kendall, but I was just going to remove the Hanover County logo because I basically just take their forms and put them on my own Hanover Caroline letterhead.
Yeah. Yeah, the county does that too. They just take their forms and put the pokey seal on it. And, but those should be, I think they even recommend not altering those on the site where you get those, if I remember correctly. So you might not want to, you might just want to go ahead and share those. I don't know if I have links to the new documents weren't out yet. So I know I don't have links in my documents to that.
Okay, I'll share them.
Okay, that'd be great.
Thank you, Sharon. I've posted in the chat box also the link to register for the October 7th training with Terri. We can certainly do a follow-up to this, and I've captured a few of the comments you had in your chat box to pass on to Terri too, but certainly planning will still be underway for the next month. So if there's after you dig through these materials a little bit more, you have some questions, certainly circle back with Terri and myself, and we'll be sure to include it in our next training update.
And I just put the not in there for the district to not be responsible. So I will resend that to you, Kendall, in a minute.
Thank you. I'll be sure to post that one when I send everything out by tomorrow, guys.
Thank you.
That, if there's any more questions for Terri, this is your last chance. Otherwise, I'm going to toss it back to Susie to talk other next steps and to wrap us up.
Thank you, Terri, for everything. This was really, really helpful, and hopefully as we dissect it, you know, if we have any other questions, people can get back to us and we can pass those on to you.
Yeah, that would be good. It's not as overwhelming as it sounds, as it seems, I think. It just feels like a lot. I've tried to make it as easy as I can.
Thank you. Okay. So basically, I think, Kendall, was what we were going to just ask everybody to send us their comments for what they'd like to see for that October training. If they'd like to maybe have another admin call at some point in late October, early November, just get back to us and let us know your thoughts. But we really appreciate everybody participating today.
I do also want to note a couple items. So if you're still playing, I'm going to launch a poll for you so that at least we know an answer to this before our October 7th. Does your district have on file up-to-date job descriptions for staff? Kind of a quick poll to let us know yes or no, and that gives us an idea of, one, not only is it important for you for your assessments, but two, if that's a needed conversation in October. I'll give you just a second or two more to vote. I see them coming in still. Kind of really proud with the answers so far. All right, I'm going to close polling and share the results. I'm happy to say 91% of you, or 21 of you who voted, do have up-to-date job descriptions. 2 of you are unsure. I'm very
proud.
Me too, Terri. That's to your credit, because you've helped districts a lot in this effort. I also have one other question to launch for you. It's a really broad question, and it could go a number of ways, because has your district board adopted COVID-19 workplace policies? This also gives us an idea of whether or not we should focus on some more of this in October. All right. So this one is a little bit more all over the place. I'm going to end and share results. Sorry if I just cut somebody off. but it's straight down the middle. You've got 13 people who voted yes and 10 who voted no. And while I know some of you who may voted yes or potentially have something that you've approved, I know some of you have reached out and said, we approved something back in April, but that's not really relevant now. So your answer might be yes for that, but it certainly could be changing on a daily basis. So it might be that we really need to focus a little bit more on this come October, and this polling question was kind of helpful to understanding that. The other question I had for you, not polling wise, but Susie, we had gotten a question or two via email prior to this about the manual, the operations manual, and I thought maybe you'd want to give a little bit of an update on where we're going to head with that.
Kendall and I talked about this yesterday, and with there being so much that we all are dealing with related to COVID, and just especially after listening to all this with Terri just now, we thought it might be better to focus the next couple months on everybody getting up to date on the COVID policies. And then we would do a update of the operations manual. We'd look at it again in January, and then we can try and incorporate some of this COVID stuff into that operations manual. So I think we're going to put a pause on updating the ops manual until January while we get all the COVID stuff in line, and then it can be included. Does that sound okay to everyone?
I'd be curious if folks have concern, because you're right. I think so many of the resources that are being developed with Terry's help right now will probably be resources we want to include in any operations manual revision. And that's partly why we're not intentionally trying to move it down the road a little bit or kick the can, but want to make sure we're being inclusive and capturing everything. I see from the chat box some folks are okay with that. I also see from the chat box, Terry, something to keep in mind as we head for October. The response to one of the questions about the COVID policy at a district says we have a policy, but our board did not approve it. They declined. So maybe we need to work on maybe some revisions or offering any insights and guidance, but that's a really good comment to know, recognizing our October 7th training is going to be really targeted for both directors and staff.
Yeah.
Okay. Guys, I know it's right at 3 o'clock, so unless there's anything, last burning question, speak now, or feel free to reach out to me in the next few days. I say by the next few days. I didn't mean to cut somebody off just then. By tomorrow afternoon, you should get with me in posting. But go ahead, and whoever I accidentally cut off. Sorry.
Hi, Kathleen Sullivan. I'm sorry. Just listening to the conversation. I know we're getting ready to wrap up, and I know we had. I see Jackie's on here from DCR. I just want to know where DCR fits into this training, and if these are requirements and we're required to do these things by the state, where does DCR fall into some training, or at least letting us know that these are policies that we need to implement? Like, we have to have job descriptions, we have to have all these things that y'all were asking for in this poll. Some of these things seem like DCR should be reaching out to us as districts on that level, letting us know that these are required, because we are required to have certain things in our personnel policies. So that's my question. If anybody is on here that represents DCR, where do they fit into this picture where we should be required to be doing these things?
Hey, Kathleen, this is Blair. So the truth is we don't really fit into this picture, because these are requirements coming out from OSHA, from the Department of Health, from the Department of Labor. So like, our division is not necessarily, we're finding out about this in the same time frame that you guys are finding out about this and having to make the same accommodations. So it's like, you know, our grant deliverables require that you have a personnel policy and a job description, but we don't necessarily require what specific, we have some specifics that need to be in it, but especially with job descriptions, we don't have any, requirements for what's in the job description. But we actually don't have access. I mean, we have to, like, our HR just sends us random bits of information too. So in all truth, I know about as much as you do on all of this.
Kathleen, you make a good point. There's certainly a partnership there with DCR, and some of this is in your grant agreements to in some ways keep the district informed that these are requirements even outside of them. For example, the FOIA one may be a requirement in your grant agreement, but it's actually not a DCR grant requirement as much as a Code of Virginia requirement they're ensuring you're aware of through your grant agreement. And it's not just a partnership with VCR in that sense of your grant agreement, but with the association, because we try to help really provide some training opportunities knowing some of these things are in your grants. For example, I would hope that many people did say your job descriptions are up to date, because you're right, you do have a language in your grant agreement that maybe says you need to have personnel policy and all. Now, whether or not it's actually up to date and truly a reflection of might not be monitored as well as maybe what it could be. So whether or not up to date is defined by DCR, I'm not positive it is, but I think the association's trying to help fill a gap in terms of some training needs, and hope this is of help for that purpose.
Yes, I so appreciate that, Kendall and Blair. It's just that, you know, when you have someone like me, it's been around a long time, you know, it's so used to DCR being that umbrella to make sure that we are staying in compliance. And I do understand all of this stuff is rapid and everything's changing. So yes, I most certainly do appreciate all the work the association is doing, and you know, just everybody sharing all the information. So thank you.
Kathleen, if it helps, job descriptions at a minimum should always list your essential job duties, the reason, basically the reason the position exists. So the things that that position has to get done, and it has to, the minimum requirements that support those job duties. So you can't just like to have college people if you've got, you know, a receptionist, she doesn't need to have a college degree. Your minimum requirements and your, and that could be whether it's knowledge, like bookkeeping knowledge, or knowledge that is like degree related because you want them to be your education coordinator. But it basically is your essential job duties and then the minimum knowledge, skills, and abilities required to perform those duties. That's the essential ingredients.
Yeah, I'm sorry. Yeah, Terry, we don't have any issues with job descriptions.
Oh, okay.
You know, we have update job descriptions and very detailed. No, so I wasn't really asking about the job descriptions. It was just, you know, some of the new things on COVID and all of this blitz was coming about. And so, yeah, but thank you for everything, Terry.
Oh, you're welcome. It feels like a blitz every day now.
Anything remaining? Guys, I know this conversation is going to continue. I've captured the idea that in October, directors need some training on COVID requirements also from the chat box. And as you have additional input, please pass it on. Drop it in the comment section when you register for the October 7th training. You can put your thoughts and questions there too, so it can help us prepare a little bit better than at that point. So with that, you know where to find us, and I'll have the recording, the attachments from today, even the Library of Virginia links, and you should be in your inbox by tomorrow, close of business. Susie, Terry, thank you both. I'm so appreciative of the participation and hope you have a great rest of the week.
Thanks, you too.
Thank you for everything.
Thank you. Yep. Thank you. Bye.
Thanks.
Bye.
So I'm gonna save the chat.
Hey, Kendall, it's Blair.
Yeah.
Just FYI, I've reached out to our HR department to find out if our COVID training video that's required, it would meet the needs of the district, and see if we could share that. So, but I haven't heard back yet.
Okay. Yeah, if it becomes available, I think it'd be a great resource that we can add for folks to.
Yeah, I think it's actually just shared on YouTube. So I think we could send it out. Whether or not it qualifies to meet the district, the code requirement for districts would be my next question. But I've asked them that question too. So I'll let you know what we find out.
That sounds
Blair,
great.
if it's on YouTube and you send me a link, I can check it.
Okay, yeah, I'll send you the link, Terry.
Thanks.
Awesome. Hi, teamwork. Thank you. All right. Guys, I'm gonna save our video and our chat box and
log us out.
Yep, and log us out. Thank you very much.
Bye.
Thanks, guys.
Bye. Bye. you.